our last talk is Dr. S. Bharti. Dr. Bharti is the CEO of Bharti Eye Hospitals in Delhi. He's one of the most wonderful cataract surgeons in the country, and we call him the Dronacharya of cataract surgery and the refractive surgery also. So Dr. Bharti is going to talk on suture ring fixation and the technique to manage subluxated cataract. Dr.
I'll
Bharti.
just show you this 30 seconds video.
Yeah, sure.
So this is how we do a vitractor axis. Go ahead, put the vitreous probe inside, start suction and cut. And that you continue to suck and see how the whole capsule.
So what are the parameters, sir? You are doing it so?
This parameter is 600 vacuum and almost I would say about 100 to 400 cuts. It's simple normal anti-vitrectomy settings.
Yeah.
There is no change in the settings for this, and you can see the whole thing has become. I've taken the vitrectomy cutter out. There is no extension. One more tip I wanted to give: in a very soft cataract, we can always do once you have done a rexis, instead of doing any hydrodissection, hydrodelineation, whatever, you can put viscoelastic. So if you put viscoelastic, the whole the AC should be shallow. You should drain whatever you have put in the antechamber and then go with the viscoelastic and put a viscoelastic behind the rexis. It goes behind the nucleus and pushes itself, the nucleus out, and you can take it out very comfortably. It will not rupture. So that is okay. So now I have to find out what is the subluxated where is my subluxated cataract, and there are a couple of videos for subluxated cataract. So I am showing you one of those subluxated cataract with mydriasis, and let's see how I manage it. It is a subluxated cataract, and the initial things are very comfortable and easy. There is no problem. You can go ahead and do the rexis very peacefully. This is actually today, if I have a subluxated cataract, I would do a flax, do a femto laser, anterior capsulotomy, and this is a new a capsular hook and a iris hook combined in one. So this is a very good tool in your hands. You can put one into the capsule and other onto the iris. So once you have put both of them, then the pupil will also remain dilated, and even if there is a subluxation, the whole thing will not go back. So this is one thing which is, and it is available from our own Gupta ji. Yeah. So this is very easy to find, and there is no problem in that. So you can start doing, once you have found that this subluxation is taken care of, you can do whatever you want. You can do chopping, you can do division, whichever way you want to handle this kind of case. It's not very difficult, and you can manage it. This is one case, and the other thing I think we wanted to show was the suture ring fixation. This is much easier, and I think anybody can do it. There is nothing great about it. So I'll stop it here, and let me find out. Okay. This battery is gone. My own battery is also bad.
Power bank लग जाएगा.
बहुत ज़्यादा कम होगी सर.
So this is one case of subluxated cataract, which is nearly 270 degrees subluxation. As you can see from here to here, there is a large subluxation with a lot big zonular defect, and I have already made a flap, scleral flap, so that if I want to do a Sioni ring, and as you can see when I am doing the rexes, the whole lens complex is moving, and I have to be very careful that I am able to do this rexes with a very peaceful way, and then I do a hydrodissection, because without a hydrodissection you cannot put a Sioni ring. So, and to hold the rexes, I want to put a iris hook, since at that point in time the capsular hooks were not available with me. I was kind of using iris hooks for all these cases, and as you can see, once you have put the iris hook, there is no problem. All these this cataract was pretty kind of soft. If you have done a good hydrodissection, you can do in a IA mode also, you can do this. Now I have to put a Sioni ring, and once I want to do a Sioni ring, I have to put a 26 gauge needle on one side, and then take the other end of the suture out, and then a segment. It's not a complete ring, but it's only a segment. At this point in time, the iris hook is out and sitting comfortably. There is nothing I want to do with that. And once I have done that, okay, not a Sioni segment, it is a complete ring. So I have to put this and gradually slide it in the capsular bag. Once I have done it in the capsular bag, I want to tighten the suture on the sclera so that the whole capsule and capsular bag is completely stabilized. And if you have only one suture, then you can use the same needle and tighten it, and do a knot on one suture itself. There is no problem. Once you have done that, you can stabilize this thing very comfortably, and after that, if you think that everything is stabilized, you may continue with your phacoemulsification and do the implantation. And then take the cortical matter out with irrigation and aspiration. And as you can see, because of the iris hook, the pupil was slightly peaked, but now that is all gone. There is no vitreous in the antechamber, and there is not much of an issue with that, and you can put the pupil back and put the IOL. So this is one way of doing managing. And there is another case, if we have time. We have time? Do we have time? It's already 5:15. There is another subluxated cataract with zonular deficiency. As you can see, this is even larger. There is a kind of huge defect, and I'll just let us bring it to the okay. Sorry, what has happened, I don't know. It was working fine. Suddenly it has stopped. या कहाँ से चल रही है? फास्ट फॉरवर्ड कर दे के लास्ट का मुझे 1 मिनट दिखाना है. कहाँ से दिखा सकता हूँ? ऑप्शन नहीं आ रहा. I think it is a video of about 4-5 minutes, but whatever. So as you can see, this is the end of this. You see there are 2 Sioni ring segments which are sitting here. They are already sutured. The IOL is sutured, and since this so you can put 2 Sioni rings to stabilize the bag, and there is no problem in doing more than 1 Sioni ring to stabilize. There is absolutely no problem in that. And then after that, since this is a traumatic case, so I will probably put a iris implant in the bag, so which can kind of take care of the. So there are 2 iris implants we have to put, because 1 iris implant will leave spaces in between, so they have to be going inside the capsular bag. And once I have put the first one inside the bag, unfortunately I cannot fast forward it, so second iris implant goes. They are actually 2 segments of iris implants available from Morture. I don't know whether they are available in India by any Indian company like, but I think IOCare can make it now, because they are making customized, requirement. As per your requirement, they can manufacture and give it to you. So these are iris implants, 2 of them, and then you can put one over the other in a manner so that their gaps are covered. And once these gaps are covered, they are inside both of the IOL and the iris implant. Everything is inside the bag. So bag has sufficient capacity, since the crystalline lens. What happened? So that can be done. I am sorry for whatever glitch there is in this video. Sorry for that, but you can do it, I am sure, and I did it and worked wonderfully well. Thank you.